everybody, welcome back to our channel. I'm Dr. Ramel from City Skin Clinic, and today I thought we'd have a chat about Botox for acne. There's just so much information out there. I know I get a lot of questions from my patients about whether Botox for acne what could be suitable for them. It's something that has received kind of quite a bit of press, mostly positive press about it, but I think it's important when offering treatments, and particularly things like Botox, which is a prescription drug. It's really important to basically have a very evidence-based approach when offering treatments. And also from a kind of satisfaction point of view, it's really important to only offer treatments that you can be 100% behind and know that they're going to work. So firstly, what's kind of the evidence or science behind using Botox for acne? Well, we know when you inject Botox into the face, you can do a few things with it. So number one, you can smooth lines and wrinkles because you're injecting it into the muscles, and those stop the muscles from causing wrinkling of the skin. It works beautifully for that, and it's licensed for use for that. Other things that Botox we know work really well on the face for is you can use it to kind of gently shape the face. You can use it to do things like if there's excess mobility, sometimes when people talk, their nose kind of goes up and down a lot, so you can use it to control that. You can use it to treat gummy smile so that there's not you don't show your gums when you smile. You can use it to correct some asymmetry if someone has one side of their mouth that's pulled down more than the other. You can use it to treat kind of some jowling and to help soften certain folds in the face. You can use it to help kind of snatch your jawline a little bit. You can use it to correct a square jaw and slim the jawline. You know, and these are all injections into the muscle, and in the neck you can help smooth out the neck and lift it and give it a tighter appearing look. And then if we also know that for hyperhidrosis, and I've just done a video about this, we can use Botox to treat excessive sweating in all sorts of areas, including the face. And in that situation, rather than injecting Botox into the muscle, we're injecting it into the skin, and it basically stops the chemical signals that are required to trigger sweating. So where does Botox for acne come from? Well, it's based off initially a few years ago a small study, and by small I mean nano, only 20 people, and this basically they showed that actually injecting Botox into the skin can reduce oil production, it can reduce the appearance of pores, and as such help treat acne. So this is obviously quite promising. It's not clear how this works, and it's a very, very tiny clinical study. But we also know anecdotally from our work as doctors, not just at our clinic, but other clinics, you notice things like in some situation where you're injecting Botox, let's say for excess sweating, and someone might report, oh, not only is my skin dry, but it's also improved my acne. And also in situations, for example, when people get Botox to smooth their foreheads, they sometimes notice that actually they're experiencing fewer breakouts, they have smaller looking pores. And so Botox, there is evidence, it's weak evidence because it's not a proper controlled clinical study, but there is evidence that we all see that it does help. And how it helps, it's not clear. Is it working in the same way in terms of hyperhidrosis, where the Botox is blocking signals that cause excess sweating? Probably the Botox is doing that the same with the oil glands. And so that's where we think it could be happening. So a big part of this is, yes, there is scientific evidence there. But does that mean, is there enough evidence to start using Botox as a treatment for acne? No, not in my opinion, and I'm going to tell you why. So firstly, to use Botox for acne, you would need, firstly, really good clinical trials that show that it is not only an effective treatment, but a better treatment than what the really good treatments that are currently available for acne. Number two, we know that even if there is evidence that shows that Botox is a good treatment for acne, which there isn't, but even if there was that evidence, it is unlikely that you would be able to use it in acne for teenagers and younger people. It's probably going to be a treatment that's limited to adult acne only. And to be honest, adult acne is it's the kind of the easier acne, in my opinion, to treat. So that's another kind of problem with that. And the third, which is really important, it's behind safety. So with acne treatment, if you're injecting Botox, you're running into the risk of a lot of side effects. So one of these, if you're just injecting Botox for acne, is if the Botox migrates. So you want to be injecting it very superficially, but what if it migrates into the muscles? If it migrates into the muscles, it'll affect facial expression if you're injecting the Botox into the face. So that could be anything between sort of reducing facial expression, which is something that you might not want. It could also result in things like, if it's in the muscle in the wrong place, so it could end up with eyelid drooping. You can end up with kind of asymmetry of your smile, asymmetry in the face. And these are side effects that can happen if you inject Botox anyway, but particularly if you're injecting it superficially, you're really wanting to completely avoid all muscles. They're not permanent because the effects of Botox aren't permanent, but it's something worth considering given there are so many good treatments that don't carry these side effects. The other thing is Botox is temporary. So even if it was a great treatment for acne, and even if the side effects were worth it because it's so much better than other treatments, again, there's no evidence for this at all. Is it something sustainable? If you're someone who suffers from acne, do you want to have Botox injections every 3 months for acne? Some people might say yes, but it's something just worth considering when actually there are better alternatives for acne treatment, and I'm going to leave kind of links at the end of this video for some of these treatments. But there's good skincare, so things like retinoids, particularly tretinoin, are amazing for treating acne. There are also things like specific skin systems like Obagi that can help treat acne, things like benzoyl peroxide. There are just a lot of things that you can do to treat acne, and not just treat acne, but treat it effectively and in the long term. And I think that's what most people would strive for. You want to go on a course where you have a treatment that works, and then you're really kind of keeping acne at bay rather than starting afresh every 3 months or so. So that's really kind of where I'm at with that. And when patients come, we absolutely refuse. If the only reason someone wants Botox is for acne, then I would say it's really it's not worth your time, it's not worth your money. There are far better things that you could do for your acne, either just yourself using some at-home products or clinical treatments that are going to be more effective and far better investment in terms of your time and your money. If, on the other hand, you want Botox, for example, to smooth your forehead, you happen to have acne on your forehead and you ask, will it help my acne? The answer is potentially. If you're having the Botox for something else anyway, and that's the reason, great, do it. And then if it does help with your acne, see that as a bonus. But don't go in with that expectation, because if you do and it doesn't work, there will be disappointment and you'll feel like you've wasted your time and your money, and you really don't want to do that. What you want to do is have treatments that make you feel good, that you can be confident in, that you get the outcomes that you're hoping for. So again, with everything like this, it's really important to have an honest discussion with your practitioner. And I'm a big advocate of kind of establishing that kind of good relationship between doctor and patient, particularly for aesthetic treatments, because it is a journey and you want someone who is going to understand what you need, but also be honest with you if they think something is not going to work, because you know, at the end of the day, these are treatments that are supposed to improve things and make you feel better. And the worst thing is you have a treatment that makes you feel worse than you started off. So I hope you found this useful. I'm not a Debbie Downer, and I do like to promote treatments, but only if we can be confident of the evidence behind them, and I know that it's going to provide a really satisfactory result for myself and for my patients. If you have any questions about acne, Botox for acne, or any kind of skin treatments, please leave a comment and I'll get back to you. If you haven't done so already, please give this video a thumbs up. And if you're new to our channel, welcome. Please hit the subscriber button. We're posting videos 3 days a week. And so you can kind of keep up to date with our content. And if you're returning to us, welcome. It's great to have you back. Until next time.